How does lumbar puncture confirm leukemia in the CNS? Imagine trying to find tiny hidden clues that show leukemia has spread to the brain and spinal cord. A lumbar puncture, or spinal tap, is the key tool doctors use for this. It involves inserting a thin needle into the lower back to access the fluid surrounding the brain and spinal cord, called cerebrospinal fluid. This fluid is then carefully collected and examined under a microscope. If leukemic cells, especially immature cells known as blasts, are found in the cerebrospinal fluid, it confirms that leukemia has invaded the central nervous system. Leukemia usually starts in the bone marrow but can spread to other parts of the body, including the brain and spinal cord. Sometimes, patients with leukemia might not show obvious neurological symptoms, making it harder to detect CNS involvement without testing. That's why a lumbar puncture is so important, especially in cases of acute lymphoblastic leukemia and sometimes in acute myeloid leukemia. It helps doctors see if leukemia cells have moved into the nervous system, even if symptoms are subtle or absent. Once the cerebrospinal fluid is collected, laboratory techniques come into play. Cytology, which involves looking at the cells under a microscope, can reveal the presence of leukemic blasts. To improve accuracy, flow cytometry may also be used. This technique uses special markers to identify and count tiny numbers of leukemic cells that might be missed with standard microscopy. Detecting these cells confirms CNS involvement, which is crucial for staging the disease and planning treatment. Knowing whether leukemia has reached the central nervous system influences the treatment approach. Patients with confirmed CNS leukemia often receive intrathecal chemotherapy, which is medication injected directly into the cerebrospinal fluid. This targeted therapy helps eliminate leukemic cells in the nervous system, reducing the risk of relapse. In summary, a lumbar puncture confirms leukemia in the central nervous system by collecting cerebrospinal fluid, detecting leukemic blasts through cytology and flow cytometry, and providing vital information for diagnosis and treatment. This procedure is a cornerstone in leukemia management because it helps ensure that CNS involvement is identified early and treated effectively. Always remember, if you or someone you know is undergoing this procedure, it's essential to consult healthcare professionals for personalized advice and care.